Welcome to the course HIPAA Training for Business Associates. In this training, we'll cover the following: the role and responsibility of a business associate and its relationship with covered entities, the HIPAA privacy and security role and its standards and implementation specifications which result in organizational policies and procedures which may differ between organizations, and key safeguards to protect PHI, which is protected health information, based on the leading causes of breaches. First, let's start off with some of the basics about the HIPAA privacy and security role. There are quite a number of misunderstandings concerning HIPAA. One news article tells the story of a citizen being detained for taking pictures of an accident because a police officer believed it was a HIPAA violation. In response to another news article, many readers complained that the news company violated HIPAA by reporting on the medical condition of an individual who was arrested at a clinic. In a moment, you'll understand why both of these situations are not HIPAA violations. You may be surprised that there is more to HIPAA than the privacy and security role. The Health Insurance Portability and Accountability Act of 1996 also introduced regulations to protect insurance coverage when employees lost their jobs, set standards for electronic healthcare transactions, set pre-tax spending accounts, and provided guidelines for group health plans and company-owned life insurance policies. In this course, we will focus on the privacy and security role found in the administrative simplification of Title II of the Act. As we get started, it's important to know three different things. First, who is required to follow the HIPAA regulation? Second, what does the HIPAA regulation protect? And third, why does this matter? As we look into the basics of HIPAA, we will answer these three questions. The HIPAA privacy and security role applies to covered entities and their business associates. A covered entity consists of one of three types of organizations: health plans such as health, life, or dental insurance; health clearinghouses, which are organizations that provide specific services such as billing, repricing, and community health systems; and healthcare providers, which are hospital systems, hospitals, clinics, diagnostic centers, medical labs, and the like. As mentioned earlier, there's another type of organization, which is the business associate, which we'll now look at. Covered entities depend on the number of third-party services such as accounting, financial, technology, billing, and legal services. Any person or entity that performs certain functions or activities that involve the use or disclosure of protected health information on behalf of or provide services to a covered entity is a business associate. There are two key words in this definition: used and disclosed, which are important to understand. Use means with respect to individually identifiable health information, the sharing, employment, application, utilization, examination, or analysis of such information within an entity maintaining such information. Disclosure means the release, transfer, provision of access to, or divulging in any other manner of information outside the entity holding the information. If a covered entity is using a third-party billing service and discloses protected health information to that company, the billing service is a business associate. Covered entities are required to enter into a business associate agreement with business associates. If the billing company in this example uses other services such as legal or cloud technology, they are required to enter into business associate agreements with those services. All business associate agreements require that the business associate enter into a business associate agreement with each third-party service that receives, uses, or discloses PHI. For example, if a covered entity used a web-based email service that occasionally contained PHI, the covered entity would be required to enter into a business associate agreement with that service provider. If the email service provider used a cloud-based storage service to store email, the email service provider would need to enter into a business associate agreement with a cloud-based storage provider. Business associate agreements are required for all third-party services downstream. This is why it's necessary to seek approval when adopting technology based on a service provider or cloud-based solution. Let's take a closer look at Protected Health Information, or PHI. Protected health information is identifiable information which relates to an individual's past, present, and future physical and mental health, the provision of health care to an individual, or past, present, and future payments for health care. Identifiers can include first name, middle name, last name, address, and telephone number. However, medical record number, financial record number, and account numbers are also identifiers. Perhaps the most commonly overlooked identifier is any form of date. For example, date of birth, date of registration, or date of procedure. The privacy rule consists of 18 identifiers, the last being any other unique identifying number, characteristic, or code. PHI consists of at least one identifier with health information in any format, such as written, verbal, images, or electronic. Healthcare data received, stored, or transmitted by a business associate in relation to the provision of healthcare, healthcare operations, and payment for healthcare services qualifies as PHI. This includes information you may have received in error. For example, if a covered entity accidentally sends an email with PHI to the wrong business associate, that business associate is required to protect the information. PHI in electronic form is called ePHI, or Electronic Protected Health Information. The purpose of the distinction relates to the security rule. The electronic form of PHI requires significantly more safeguards. With non-electronic PHI, the rule is to prevent unauthorized use or disclosure. With electronic PHI, there are standards and specifications which are required. For example, authentication, encryption, and auditing. As a business associate, why is it important to protect PHI? First, it demonstrates our respect to clients and their patients. By entering into a business associate agreement, your organization is promising to protect PHI. Second, it is the responsibility of a business associate to protect PHI according to both the privacy and security rule. Third, your attention to privacy and security affects the reputation of your organization. All three of these items relate to one key concept, and that is trust. Covered entities trust you with their data. Your organization trusts you when working with their clients' data. And future clients evaluate your reputation to establish trust. In this section, we're going to look at policies and procedures and how they apply to the HIPAA privacy and security rule. Policies represent the desired outcome of senior leadership of an organization. They establish rules for behavior and expected outcomes. Procedures, as you may have guessed, provide the how-to in meeting the objectives and requirements of a policy. Policies and procedures play an important role in meeting the requirements for the HIPAA privacy and security rule. Before we start, take a moment to answer the question, is it more important to know the HIPAA privacy and security rule than your organization's policies and procedures? Remember your answer and we'll review it in a moment. The HIPAA security rule provides standards and implementation specifications required to protect the electronic form of PHI. Standards are high-level requirements, while implementation specifications provide specific objectives. All standards are required to be met by covered entities and business associates. However, implementation specifications have some flexibility. Implementation specifications are categorized by required and addressable, which is a bit confusing since both categories are required. One required as is, and one allows for alternatives that accomplish the same goal. Required means required, whereas addressable means required or something to the equivalent. Addressable does not mean optional. HIPAA was designed to allow for flexibility. This is why you'll find that the implementation of the HIPAA security rule may differ from covered entity to covered entity. For example, Section 164.3.12, Technical Standards, Standard Access Control, requires unique user identification. Some organizations may use a username and password, where other organizations may use a badge and a pin. If your organization is audited by the governing body over HIPAA, they will be evaluated on two things. First, how well the organization's policies meet the security rule, and second, how well workforce members follow the policies and related procedures. So back to the question, is it more important to know the HIPAA privacy and security rule than your organization's policies and procedures? It is always best to follow your organization's policies and procedures unless you know that they are less restrictive than the security rule. There are a few key standards and safeguards all workforce members should know. We'll look at a few of them, but not all. As a workforce member, it is your responsibility to know, understand, and reference policies and procedures provided by your organization. Perhaps the most important concept in the HIPAA privacy rule is a minimum necessary standard. This standard requires that business associates evaluate their practice and enhance safeguards as needed to limit unnecessary or inappropriate access to and disclosure of PHI. It's important to know that the minimum necessary standard does not apply to workforce members in the provision of care as it relates to the individual patient. Clinical staff may have access to all the PHI of an individual if they are involved in providing care for that patient. When PHI is used for payment or operations, the minimum necessary standard applies. This also applies to research, but there are specific rules for such purposes. Another safeguard is a unique user identification specification under the access control standard. Each workforce member is required to have a unique login and password in order to account for the use and access of a system. As a result, covered entities and business associates have a strict policy not to share passwords. Use of shared credentials, that is login name and password, should only be used when it is absolutely necessary and not for convenience. An important safeguard is encryption. Ignoring this safeguard has resulted in resolution agreements with the government in the millions of dollars. All storage devices must be encrypted, unless approved according to your organization's policies and procedures. An example not to encrypt would be to prepare a USB drive for marketing. Otherwise, all other USB drives must be encrypted. Software, cloud services, and mobile apps need to be assessed and approved prior to use. The privacy and/or security officer will need to determine if a business associate agreement is needed. Determination is not only based on the intended use, but the potential unintended use and the risk PHI may be disclosed. Use of non-approved apps or devices can result in confidential information being transferred or stored on unsecured platforms, and could even lead to a breach. Let's take a look at an example on how a hacker may obtain unauthorized access through PHI on a mobile device, online application, or through unapproved hardware. In this scenario, Bob emailed a document to his personal email address so that he could access it from his personal cell phone. When he opened the document, a copy was saved on the phone, which was later backed up to the cloud. Later that week, Bob's account is hacked and the confidential information is copied and posted on the darknet. Opening documents on a smartphone or tablet often makes copies of the document, which can be copied again to an online file or backup service such as Dropbox or OneDrive. Additionally, opening files on a personal computer may result in a copy being stored locally. If you ever have questions about what is right or wrong, refer to your organization's policies and procedures, as they will provide the necessary safeguards to protect the organization's information, or reach out to your privacy or security officer. Remember, if you ever suspect that information has been compromised, immediately escalate the situation to your supervisor and follow your organization's incident procedure. In this scenario, Mary uses the same password for all of her accounts. One day, a hacker is able to steal data from a travel website she often uses, which includes her username and password for that site. Since she used her work email address as a login, The hacker tries to log into the company's email website with the same email address and password. Within minutes, he starts downloading confidential company information. Later, he tries the same username, which is her email address, and password on many other websites. Never use the same password for multiple websites. And when available, use two-factor authentication. In the last scenario, Bob is really having a bad week after the data breach involving his smartphone. However, on his way into work, he discovered a USB drive in the parking lot. Curious about what was on the drive, he plugs it into his computer. He thinks to himself, if it contains confidential information from someone else, then it wouldn't make my breach look too bad. However, within seconds, his computer is infected with ransomware, which encrypts all of his files and starts spreading through the network. The lesson here is to never plug in a device that is not authorized by the organization, especially ones that are found. If there is one takeaway from this course, it is to read, understand, and refer to your organization's policies and procedures when making decisions that involve protected health information. Policies, procedures, and standards sometimes vary from covered entity to covered entity or business associate to business associate, so make sure you understand what is required of you by your organization. In this training, we covered the role and responsibility of a business associate and the relationship it has with covered entities, how the HIPAA privacy and security standards and implementation specifications result in organizational policies and procedures which may differ between organizations, and key safeguards on how to protect PHI based on the leading causes of breaches. This concludes the HIPAA Privacy and Information Security course for business associates. If you have any questions about the content in this course, please reach out to your immediate supervisor or contact your organization's privacy or information security officer.